And then another indicator is societal thoughts. People who think that there is no hope for life, people who feel like they are worthless, they often think that, okay, let them just do away with themselves and then end the whole thing. Another thing is low self-esteem. There are people who feel that this particular thing, I cannot do it, I'm not up to that, I will not be able to do it, and then that also plays down on them. There's emotional disburst. There is sudden dramatic changes in the mood that you have. Maybe often you used to meet with your friends, you laugh with them, you socialize with them, you share a drink or food and whatever. But when you are in this condition, you are not able to interact with them as before. Then another thing is that some people will fall into drug abuse because they think that is where they find comfort. They will get into taking of alcohol, taking of drugs, and they feel like they are up to the task. Then they also neglect some of the things that they used to do and do them so well, because they have low self-esteem. They will not be able to perform those tasks well, even things that they used to do so well. Like, let me take for instance a scenario of a footballer who plays so well. Now, if that person is in a state of mental disorder, be it depression, be it anxiety, that person will not be able to play so well, because the person will feel like, I cannot do it well at this time. Another thing is they will get to participate in risky behaviors. There are people who in their state of mind, in their bad state of mind, they may engage in driving. For instance, if you are driving and your mind is not stable, then you are at risk. That's a risky behavior. Some will even go as far as engaging in unprotected sexual intercourse.
Okay, we are getting to that. So all of this you've mentioned is under depression, right?
Yes. And anxiety.
Anxiety, yes. Depression, or mental disorder.
Yes.
All right, we are talking about mental health. I'm coming to you, Jocelyn. That's your name, okay? I just wanted to tell us about mental health. We are talking about mental health, mental disorder, because I know that you are coming, you already prepared a lot of things to talk about, so I don't want to derail you. So let's just get your own contribution to mental health.
Okay. Mental health in our society nowadays has been neglected a lot, but still this is the main problem most youths are facing, especially girls. Some of us come from homes where we are not appreciated. They treat everything we say, no one listens to you, your needs, they don't take care of it, and you see yourself being left alone. Your parents called you for almost everything and you're just there. You go to school, you don't see like you fit in. You feel isolated, intimidated by your friends. Or maybe when you come to school and you see your friends with their parents, because like they are lovely, they are happy, and you don't get that from your own family, you're worried. It disturbs you. It can even drive you crazy. So some of these young girls now can get engaged in some kind of activities. They might join bad friends thinking that maybe that's the best thing to do, or maybe that's where they belong. Yeah, so they'll join these people, and for sure such people always take advantage of your vulnerability. Say you're a girl and maybe there was a guy that was like admiring you and stuff. Once you come at that time when you're down, the person can take an advantage of you, and then it will lead you to like pregnancy. Yes, they can get you pregnant there, and from there you don't know what to do, because if you go back home you just know your parents will just kill you. You don't know what to do, and probably the last option for you is an abortion, which is also another situation which is common nowadays. Okay, so when you do this abortion, now after that you feel like you don't know what you've done. You are confused. You might be scared, feeling that probably you will die or something, and will disturb your mental health and might even push you to go do suicide. Same with boys. If they feel this way, they become violent. Yes, some get into like rough activities, stealing, drugs, meeting bad friends, and doing rough things, and become really like uncontrollable. Yeah.
Okay, thank you very much. Like I said, this is University of Buea Nursing Students Association. They are trying to educate the public when it comes to mental health and its relation to substance abuse, teenage pregnancy, and abortion, which is like I love what you just mentioned, Joycelyn, that mental health is something that is being neglected in our society. A lot of people are suffering from mental health, even in families, even in homes, and parents, and even loved ones. They have not, they fail to notice, and people are going through a lot. Let me come to you, Achille. I'll come to you, Achille. So, what do you have for us in terms of this topic of today, mental health?
All right, mental health, just as my policy have said, is a psychological and social well-being of the individual. So, once one fails to attain this emotional, psychological, and social well-being, yes, it turns to the negative side instead of the right side, which is through medications like visiting a therapist or a counselor, or also using a support system like friends, meeting family, to specialize the right friends and meeting family members. Yes, so most people turn instead to the negative side of it, like engaging ourselves in substances abuse such as alcohol, cigarettes, coca, simple term shisha, yes, and marijuana too. And also that once they engage themselves in such activities, it leads them to other negative opportunities also, such as stealing, rough and behavior, risky activities, and so on. So I would like to just encourage everyone that when we face such difficulties, let us not run to that negative side, but instead going to the positive side of it, which is going to the hospital, visit the counselor, a therapist, or a psychologist, in order to get help from him or her.
All right, thank you very much. Actually, you just mentioned something like many people will run back to the negative side. Instead for you to go to the hospital, visit a counselor or support system, like you said, most people, when they are depressed, as Ernest has mentioned, when they are suffering from depression, they fall to the negative side, and that's why we are getting today in our societies. Rina, I love your name. All right, let's see what you have for us when it comes to our topic of today.
Okay, thank you very much for that question, ma'am. Firstly, mental health. Now, there is the good mental health, which refers to the state of well-being of the mind, in which an individual is able to carry out day-to-day activities, overcome challenges, and enjoy life, everyday life. This is characterized by a positive outlook. You come out, you look good, you look bright, you look shiny. You're able to have control over your own life. One has control over his or her own life, and one is able to interact with each other. Also, there is the bad or the poor mental health, which is characterized by distress, inability to control your mood, or inability to interact with others, and also this is characterized by depression and anxiety, as Sir Ernest said. Now, we have been hearing of mental health. What are the things which cause this mental health? I'll begin with childhood trauma or neglect, as Ms. Joyce said. While the children are still growing up, they need attention. Every little thing you shout at them. Oh, your broken plate, why you hit their heads and everything. This gives them this sense of insecurity, this fear at all times, this inferiority complex, and it really damages their mental health. Also, we'll talk about poverty and debt. We are in January, so definitely most people will say, oh, January there's poverty, I'm in so many debts because I borrowed to do this or that, and this will start giving you fear. Then just imagine you sit down and the person you're owing gives you a call, or you see this call, you just off the call. But that damages your mental health. It gives you distress, it stresses you, and it causes a poor mental health. The next, we will look at social isolation and loneliness. We are students, so I'll use an example of a class in you. In class, we always have those type of students in which we call them weirdos, or the strange types. Why are they strange? Because we always tend to ignore them or move away from them because they have strange characters or they are somehow weird. This gives them inferiority. It makes them feel like, oh my God, I'm worthless. Nobody loves me. I'm completely useless. Okay, let me just die. Even if I die, nobody will notice. that damages their mental health. Now we have severe or long-term stress. You go through stress, or you're undergoing a situation for 1 month, 2 months, 3 months, a year, 2 years. You become tired, fatigue. You're like, okay, God, just let me die so that I'll rest. These are things which damage your mental health. It leads to poor mental health. Homelessness and poor housing. People who don't have money, people who are homeless, are unable to provide for their basic needs. Food they don't have, maybe some are unable to afford water or whatever. These are needs which they need, and it stresses them. It causes stress, causes trauma. It makes them vulnerable to diseases, even physical health. These then affect their mental health. Then we have domestic violence, bullying, and any other abuse, which maybe causes you to think you will die. Then you feel like, oh my God, I was about to die, or I'm dying. It traumatizes you. It makes you vulnerable to trauma. And having long-term physical health conditions, you suffer from hopelessness. You've just lost everything. Okay, fine. I'm here like this. There's no hope for me. I'm dying very soon. Fine, no problem. Your mental health is damaged. You have a poor mental health. So we are being advised that if you have someone, or if you yourself, you are undergoing certain stressors or certain things which are affecting your mental health, you should seek for advice or seek for help from mental health professionals. Thank you very much.
Thank you very much, Rina. That was good. I'm coming back to you, Ernest. We've talked about a lot of things. When people are isolated, they are anxious, and we mentioned a lot. So I just wish to find out from you, if somebody is having this mental health issue, like, can you really function properly, or is there anybody without a mental health disorder? Because all of us are going through stress.
Okay, thank you so much for that question. Actually, though health is defined as the complete state of well-being, be it emotionally, physically, it is not necessarily the absence of a disease. Now, if you want to look at that definition so well, you discover that one can never really hit your chest and say, I'm well. Because in one way or the other, you have an issue. Now, just given the fact that you have something that disturbs you is already that's a different thing from complete health. Now, if you, for instance, you are depressed, that's a mental health disorder, you will not be able to function as usual. Given that maybe you are not able to think properly, you are not able to concentrate, you lost weight, and maybe before you know it, other things may fall in, health issues may come in, because you are not able to carry out your normal daily activities. Your mental health is the best for you.
All right, Jocelyn, is, most of the times when we see people who are suffering from mental health disorder, most families, most people, communities, they always they relate it to witchcraft. They always relate it to witchcraft. So are we now saying here, as people, medical students, experts in the field, are we now saying that, especially these ones that are really mad, as if they call it schizophrenia, if I pronounce it well, is it normal for somebody to suffer from that, or we should just be relating it to witchcraft as the public opinion?
First of all, we don't have to relate it to witchcraft. Sometimes, like, the parents or the people who are relating it to the witchcraft are the cause of these people's problem. What you just have to do is talk to the person, listen to the person, get to know what's disturbing that person, try to know how to help the person, and not just sit and say witchcraft. Okay, fine. If you attribute it to witchcraft, the person will feel like, okay, why me? I'm cursed. And so, okay, I'll just have to continue like this. This is my fate. I just have to accept it. I'm a witch. People are behind me. Village people, as I always say, which is not good. So the society at large also has a role to play. We have to identify these people in the society. Probably somebody was always full of life, and suddenly the person is looking wretched, does not associate anymore, just looking different. try to talk to that person, try to get the problem, not just sit and say witchcraft or the person has done something then it's backfiring, or that's not always the case. Yeah, so that's what I think.
Okay, let me come to Achille. Achille, I wish to ask you, we've talked about, you mentioned that when people, they fall the negative side, they go into drugs, they go into smoking, they go into alcohol and all of that. Excuse me, how does this, I'm sorry, how does this affect their health? Like somebody who is into alcohol, somebody who is into drugs, somebody who is into smoking, like this shisha that you mentioned. How does it negatively affect their health?
Alright, madam. When one turns to that negative side, even to drug abuse, it can lead to addiction to those substances. Meaning, you have a mindset which will be saying that your mind depends on it. As in, without it you cannot live. Which turns, it's true that in the short term it will satisfy you, but when in the long term it has a medical effect. Which will also, as my Ernest said, that when you engage in sexual activities, other health and mental problems comes to play. So when one engages in sexual activities, such as abuse, you can use addiction. So it's addiction. Yes. You also invite diseases. Yes, which can go from any side of it, either mentally, physically, or socially in society.
All right, Rina, I just wanted to maybe add something to what Achille just said, because I know that when you are into smoking, it might maybe affect your lungs. If you're into alcohol, too much of alcohol, it might maybe affect your liver. So can you just come up with, because most young guys, like he said, when they take it, they feel that, okay, they are satisfied. I don't know why they take it, they are bored and all of that. In the long run, it destroys their system, their organs, right?
Yes, ma'am. Thank you very much for that question. Okay, first, when you smoke, you become addicted to it, as he said. Now, this causes lung diseases such as emphysema. It could also cause lung cancer. It could also cause diseases along the respiratory tract. Also, consuming alcohol could damage your liver, which is a fact. Yeah, that's why we should try to avoid these things, so that we should take care of our health. It's true, enjoyment. To you are enjoying, but in the long run, there are many things in which you will regret, or you will say, oh, had I known, not knowing if only you had passed through the positive side.
Okay, say NS, as they are calling you on set. If we look at our topic, we are saying that substance abuse in relation to teenage pregnancy and abortion. I want us to dwell more on this teenage pregnancy and abortion. Now, how does it relate? I know Joycelyn mentioned it, yeah, but I want us to go into details, because we have a lot of students that are pregnant, a lot of teenage pregnancy in town. All of them, can we say, is as a result of maybe mental health disorder?
Okay, thank you so much. The very first thing I would like to say is that in our society today, when especially ladies, as you mentioned, ladies, when a lady is facing a particular situation, though it applies to even men, you are looking for where you can have some support. You are going to somebody who can at least comfort you, maybe advise you on what to do. Now, it is rather unfortunate that in our society today, many men tend to take advantage of the young people, the young girls that come to them. When they come to them for support, maybe in the course of the discussion or whatever, they will take advantage of the lady, and then maybe the lady gets pregnant. And then when the lady comes up to them, they will say, I am not responsible. Look for who is responsible. And then that already creates a mental disorder in the lady, because she will not be able to do what she has normally. Maybe she's a student like us. If she is a student, she will not be able to concentrate in school. She will not be able to write her exams well, and then when she fails, that becomes a problem, because the family too will be behind her. Therefore, if she gets pregnant and then gets to the man who she thinks is responsible, and the man says, I am not responsible, that already tells her something. In order for her to survive, she will need to do away with the pregnancy. That is what is very common in our society today. And then in the process of doing away with the pregnancy, you never can tell the outcomes, because most of them, they go in for that not knowing what awaits them. In the process of that, they can die. So mental health, when somebody is not mentally stable, especially ladies, I'm focusing on ladies, it can push them into sexual acts, maybe unprotected, which may cause them to get pregnant. And then just that pregnancy again is another mental issue, because mentally they will not be able to survive. Now let's talk about the pressure from the family and all of that. Maybe she gets pregnant, and maybe as she has gotten pregnant, maybe the family had ambitions for her. The family was looking up to her, or they were struggling that, okay, maybe in a family nobody has actually gone to school that far, maybe she should be able to go to school to an extent in order to help the family. Now teenage pregnancy has come in, it has stopped the whole thing. So the family now will be like, why did you do this, why did you do that? That too will play a role in pushing her into to committing abortion. And then in the course of committing the abortion, who knows, maybe she will lose her life in that process. Now she has not only put herself into trouble, she has put the family into trouble and the society at large. Yes.
So people should take care of their mental health. I have a contribution here. Like I said earlier, the program is interactive. You can send us, there's a number on your screen, send us any question that you have. You can do that through WhatsApp also. Excuse me, this one says, hello Team High TV, mental health, thank you for the opportunity of learning. My question, given one of our speakers said those who are depressed tend to avoid populace, can we comfortably say that introverts are more likely to suffer from depression or are vulnerable to this situation more than extroverts? That's a question. Who is going to take that? This is coming from Mr. Walter in Boya.
Yeah.
Okay, we'll take it. All right.
Being an introvert does not really dispose you to like being depressed. You can still be an introvert, like, since we know all introverts are always confined to themselves, but they don't really have much disturbing them. They don't just feel like, they just, how do I even put it? Okay, let me put it this way. Being like an extrovert, right, they are more into the world. They trust people, and they can easily get disappointed. Well, in effect, I'm trying to say, being an introvert and an extrovert, you're more likely to be depressed when you're an extrovert than an introvert.
An extrovert, who is going all out there. All right,
Because being an when you're an introvert, I don't think introverts don't like partying, meeting some kind of people and all the likes. They don't do those things. But now, okay, I'm an extrovert. I'm not depressed. I'm not having any mental problem. I'm okay. I suddenly choose to go out partying one night, and something happens to me. Boom, depression comes in. Say I get pregnant, I don't know how to go back to my family, I don't know what to tell them, I don't know how they'll see me, and I start getting some kind of thoughts in my head, like suicide, abortion, or even running away. But say you're an introvert, you're just home, your family, few friends, facing what you have to do, you're less likely to be depressed.
Yes.
Okay, just to add to what she has said already, when you are an introvert, now remember that at the beginning we said in order to avoid this type of things, you need a support system. You need somebody who can support you. You need somebody to talk to. There are introverts who have people they look up to, like mentors. Though they are introverts, though they can have 2-3 friends and they're okay with those friends, unlike an extrovert who may have a wall of friends. So an introvert, if you have an issue, you can easily turn to those your few friends, talk to them, and then you receive help from them. They will support you, they will give you advice on how to get out of the issue. So that is to tell you that it's not all the introverts that can easily or that are prone to depression. Yes, because if they may not be outspoken as per se, but they will have a friend or two in which they trust, and then when they have issues, they get to communicate with them, they receive help from them, and then they get out of it without knowing.
Yeah, I just think that maybe if you see somebody, maybe an introvert, it's just good to spend time and talk with them. And then if you maybe talk with them, you either know if the person is depressed or maybe that's how that person was born. I believe one of you mentioned or two of you mentioned about if you see somebody who was very playful and all of a sudden the person become start withdrawing himself from the book. I think that's what would attract a lot of attention. Let me come to you, Achille. You talked about support system. You talked about people falling to the positive side rather than the negative side. And a lot of people are watching you out there. Can you just recommend, or I don't know, just give some of these things that can help people who are going through depression, that are going through a mental health disorder? What should they do? Because some of them are suffering like this, they don't even know what to do. Like you said, support system. What kind of support system should they go to? What kind of doctor or specialist should they visit to recover from the situation?
All right, thank you very much for that question, madam. Yeah, it's true that being a support system, firstly, it comes from your family. Although in some families, most people won't, like, you won't find everyone in some people, but there's one thing for sure, that each and every one of us has that one person in the family which you know that you trust that person. And you know that if you go to that person, the person is going to give you the right advice and the right thing to do. So that person can be your own support system in the family. And also going outside to the world, like your friends. Yes, so when you meet that right friend, you talk to him, gives you the right advice. Now, going out to the medical aspect of it, go to the hospital, you either for the psychiatrist, the counselor, someone who can advise you or even provide you with medications in order to help you to solve the mental disorder such as depression.
All right, I know that there are some people who even go to the hospital. I had one doctor here who said there are some patients who come to the hospital, they don't even need medication. Just you talking with them, listening and talking with them, they are already okay. They just need somebody to talk to. And like you said, maybe you are afraid that something will happen. And when you go and you meet the doctor, that's why it's advisable that when patients come, don't just take their book and start writing medication. Try and talk with them. Some of them is just depression. You talking with them like that, automatically you see them, they are fine again. And let me come to you, Winner. I want us to talk about so many of these bad behaviors. That's how I'll put it. End up most girls getting pregnant, getting into abortion and all of that. Teenage pregnancy, a young girl, very young, because when we talk about teenage, we start talking about 13, 14, 15, very young, and also committing abortion. Let's look at the health effects of these things. The negative, I don't know how to put it, the health effects of this thing.
Okay, thank you very much for that question, ma'am. Teenage pregnancy, the health effects. Okay, now, when you get pregnant at a young age, you are prone, or let's begin with when you engage in sexual activities at a young age, you are prone to cervical cancer due to vaginal what? Human papillomavirus. Yes, that's the first thing. Let's start there from the starting point. And then now, when you get pregnant, you are very, very much prone to maybe risks. These risks, you're still too young. Your cervix cannot carry a child. Your uterus, your womb cannot carry a child. So you are still too young to hold a baby. You have so many complications there. And also, you now looking at the side, because health is made up of medical and psychological aspects. Looking at the psychology, how would you even stand in the society? You start having comments such as this pitching born pitching. Yes, this damages you. It damages you in a way only you can explain. You feel the pain within you because the way people look at you, the way people see you, the way people even throw slants at you and insult you, it gives you this feeling of pain you cannot explain by your own self. And then abortion destroys your womb. Sometimes you could have a problem in which maybe they need to even remove everything plus your womb itself. So yes, those are the complications which people involve.
All right, thank you. I want us to now start looking at some recommendations that we can give to the public. Since we are talking about mental health, excuse me, televiewers, its relation to substance abuse, teenage pregnancy, and abortion. Let's now look at some recommendations, because we know that this topic like this, what we are discussing now, is what is happening every day in our society. We have thank God we have a center, the Mind Center, that helps to detox some of these young people who are into drugs, try to make them overcome, or how they call it, not to have the not to crave for these substances. First of all, substance abuse, that's one word that we have not defined. What is it all about?
Okay, thank you so much. Substance abuse is, simply put, is the overusage of something, anything. Now, in our society, we tend to focus more on abusing drugs, alcohol, and all of that. But then, to another sense, you can still abuse even food. The food you eat, you can still abuse the food, because when you get to eat more than expected, more than you require, you are tending to abuse the food. Now, falling back to alcohol and drugs, now these people, when they start taking one, they feel like, okay, I'm just taking this one to be, at least let it calm me down. That's how they say it, that it calms them down. Then maybe tomorrow they will say, okay, let me take two, and that's how it goes. And before you know it, they are addicted to it, and as they are addicted to it, you see people. I even have some friends now who are into cigarette smoking. Before, they were my friends. We were childhood friends, growing up together. But due to one thing or the other, they started taking a stick of cigarettes, and then went to 2 to 3 until death. Some of them can stand and hit themselves and say, I can take 2 packets of cigarettes a day. It happens. So that is an abuse. Now, even the alcohol that we see, alcohol, taking a sip or two, that's how people take it. But then there are other people, when they are faced with a problem, or they are having a challenge, they tend to find their own solution in bottles. Somebody will get into a bar and then is very proud to tell you that can drink down 2 crates of beer a day, or 1 crate of beer a day, 6 bottles. That is very common in our society. So, in general, in summary, when you talk of substance abuse, you are taking something in excess, more than required. Yes.
Thank you very much. I don't know why this cough is disturbing me now. This one says, good afternoon, Hi TV. Very good program, given that substance abuse is being discussed by these younger ones in our society. This is what has been a problem, especially in my area, where almost all the young boys and girls are into drugs and having, what I understand, they are becoming a nuisance to the society. So sorry for that kind of situation. Like I said, there are we want to start giving recommendations now. You know, somebody might be doing something and does not know that this thing that I'm doing is wrong, is affecting another person negatively, or maybe it's even affecting me negatively. We all, as members of the society, also have our own social responsibility of helping each other. So maybe the recommendations that I'm going to give here, you can help these children by bringing them together or directing them to the right quotas. Thanks for your contribution. I'll start with you, Wina. What are some of the recommendations that you can give when it comes to mental health for people to ensure that they don't suffer from mental health disorder?
Okay, thank you very much for your question, Ma'am Alice.
Yes.
First, we all know most people suffer from depression. The first thing and the simplest thing you can do is just to be a good listener to someone who is undergoing maybe poor mental health, who has poor mental health, or who is undergoing depression or something. Be a good listener. most of the times it should be a stressor or something which is causing them to be in that state. And sometimes maybe they don't have someone to say to. Be that someone, be that their shoulder in which they can move, be that ear who can listen. So just be a good listener. From there, who knows? Maybe you might have a word or two to say. Maybe you might be that you might just be all the person needs, just that person to listen to me. That's all I need. Just listen to me and then I'll be fine. Then that's it. Secondly, there's always this aspect of have a mentor. I'm always being told, you know, have a mentor. In everything, have a mentor. Before you do anything, before you take a step, have a mentor. So while you have a mentor, if you are going this way and then your mentor says that no, Bina, this thing you are doing is wrong, go the other way. Definitely I won't go to an extent where I will be depressed. No, because my mentor is there to guide me. If I'm going left, he or she will yell at me, he will shout at me, why did you do this? Why did you go that way? You have to go this way. So first I go this way. And then you go. Yes.
Thank you.
What I would recommend is that you as someone, if you see someone who's going through this mental disorder, what you can do is to seek for help. The sure that person might not have the opportunity in order to ask for help to other people. You are seeing that person going through that stress or that depression. Help that person. Like Ms. Wina said, first of all, you listen to the person complain. Then if you can't solve it, then you seek for help from another person. Maybe that person you are seeking help from, help the person to go through that stressful mental disorder.
Okay, thank you. I will go with the families, especially with the girls. There is this thing, like some of our parents who are very busy, they don't get to know their children. They don't get to know what they go through. They go to school, come back, they face challenges, but when they come back, they want to tell you, but when they come to you, you shut them off. I'm tired, go read your book, stuff like that. They might be facing they might be bullied in school. They don't feel comfortable. Maybe they even want to change their school, but they are telling you don't want to. Give them that audience. So my point here is, let's learn, parents, especially mothers, let's learn how to know our children, talk to them, listen to them, know their fears. And there are some parents who are so strict on their daughters. I'm talking out of experience, I don't think that's the best way to raise your daughter. Be free with her, talk with her, listen to her, know what she likes, what she doesn't. Because when you always keep her, tell her, no, don't do this, no, don't do this, she wants to know why you're telling her not to do that. And when you give her the least opportunity, like when she has the least opportunity, she just wants to like explore everything. And it can lead her to the wrong path because she doesn't even have someone to mentor her, to tell her that no, you are being refused not to do so because of so. She just goes and she finds herself in that situation. So I just want parents to like, make your children your friends. Talk to them, listen to them. Don't feel like, just talk to them. That's the main thing. Thank you so much.
Okay, thank you so much. I am somebody who believes so much in mentorship. We have spoken so much on mentorship. Now, many people do not know who a mentor is or what mentorship is. Now, in life, you need somebody who can direct you or who can advise you. Now, the best person to do that is somebody who probably has an experience or who has more experience than yourself. If you are looking for a mentor, some people will choose to go to priests or religious leaders, priests, pastors, and whatever. They will go to those people because they think that they have the spiritual aspects that they can give them to relieve their issues. Then in another case, you can go to somebody you think that can give you. In fact, you just have to look for the source of for somebody whom you think can give you what you need. You go to that person for it. And then another aspect is, I am somebody, on a personal note, I'm somebody who loves to talk. When I have an issue, I'm just looking for somebody just to talk to. You may not be able to give me anything, but I want to talk to you. As I'm talking to you, I'm getting some relief. So what I'm trying to advise is that when you meet somebody and the person is trying to talk to you, give the person a listening ear. I would give a scenario. A few days ago, I was around campus. I just met one young man who came to campus. He's a little bit older than myself. He was just moving, and then he saw me moving like that. He was not. He did not have an orientation. He did not know. In fact, he was troubled because he had issues with the family and even people who are not the family members. So he just saw me and then felt like just saying it to me. He has never met me before. And on my own part, based on my own knowledge, I knew that, okay, that man was passing through a lot. I've never met him before. And I stood there and listened to him for more than 30 minutes without saying a word. He was constantly telling me what happened and what did not happen. And at the end of the day, I could find some relief on him. He was a little bit better than I met him. So that is already a point. If you meet somebody in the community, you think that that person is in a mental disorder situation, the first thing that you have to do is at least give that person a listening ear. The person will get to tell you something and then will get some relief before even looking for other help.
Well, thank you very much. I don't know if somebody has something to add because we are concluding. Okay, yeah.
Yeah, you know, we all are future head personnel, so we can't talk about it without bringing the medical aspect of it. Yeah, when you are faced with such situations, it's always advisable to run to the health center and seek for attention, not for you to be able to solve that problem which you are going through. Like what Mela said, when there are detoxification centers, there's really the screenings of those substances you should take in.
All right, thank you very much, Achille. And televiewers, like all of them, if I could really summarize, or let me say my own summarize what they have said here, is for us to take care of our mental health. Like Jocelyn said from the beginning, mental health is something that is being neglected in the society. It's being neglected by authorities, by the government, and you, even the individual. That's why it's advisable for you to make sure that your mental health is always okay. If you know that you go to somewhere and then maybe you end up getting angry, you already know that each time you go to this place you end up getting angry, you better avoid that place. And also have enough rest, take time out. All right, take time out, go to somewhere and relax, listen to how they call it, slow music and all of that. Those things will help bring you back to normal. Mental health is not good, like they said. It's related to teenage pregnancy, it's related to abortion, it's related to pregnancy, it's related to addiction and even death, because people start attempting to commit suicide. So I wish to use this opportunity to thank my young students. I call them young doctors, okay, because I know they are already into it, and for them to come up bold to educate the public on topics like this, it means I really appreciate, and I'll thank you all for coming to the program. And I just wish to tell our televiewers I will be seeing more of them, okay? It's just good for us to be giving them the opportunity to come and express themselves, to come and educate the public. And we know while talking, we also learn, I believe so. So thanks for watching the program. Thanks those of you who contributed during this program. Make sure you join us again next week for another exciting edition. Meanwhile, stay tuned to High Television for more interesting programs.